It is true the test kits were being picked from Kemri, Kisumu, but Kemri also ran out of out of stock. So with that, it also became difficult to carry out tests among those suspected COVID patients. But we are now doing rapid tests at the level 5 facility, and we are still able to carry out those tests as is expected. But the only thing we don't do is just carrying out random tests. We only carry out those rapid tests on real suspected cases, so that we confirm and take the necessary measures. It is true, you go into Kakamega town or any marketplace, especially during market days, you realize that perhaps only 10% of the revelers or those who have come to buy, to trade, to do some trading activities are putting on masks. So it is something that is so common, and I think it's because this time around Kakamega has not been in the limelight. So people have complacence I think has set in. But I want to inform and plead with the people of Kakamega County. Health is your priority. The government only comes in to assist you, make sure that you are okay. Otherwise, to make sure that you are physically in a position to carry out your normal duties, it is up to you. So please still follow the means of health protocols. Put on masks at all times. Keep distance, wash your hands, and you'll be safe. And above all, there's been very poor intake of the COVID-19 vaccine. Now, there have been so myths. Unfortunately, our people, the Luya people, when they are unable to explain something, they will often come up with something that tries to explain what they don't know. So some of the myths that have been propagated by those people are pure lies. Personally, I've taken that jab. In fact, I've now taken both. And here I am, functionally sound. So I want to encourage any other person who is supposed to take that jab to come and take it. You are safer. Dr. Collins Matemba, I'm the County Executive Committee member for Health Services. The fourth wave, the one that is now being touted most, that is likely to occur around this June, July, I think I would wish to say that us in Kakamega are ready. Of course, we don't expect that we will be hit hard as we were during the second wave. But in the event that that happens, I want to assure the residents that we are prepared. Now, so far, things have not been so bad because our two isolation and treatment center, CGH and Mumiasi, have been open, but with very few patients. As we speak right now, there are only 9 patients at the CGH. Then in Mumias, which is still open to COVID patients, is having no patient at all. But I want to let them know, the residents of Kakamega know, that we have enough supply of oxygen. We have 2 plants, one that produces 300 liters of oxygen per minute, and another that produces 230 liters of oxygen. But that oxygen is sufficient for Kakamega County. We are not in a position to support our neighbors because we also supply the same oxygen to our health facilities. Now, over the past few weeks, we have had to allow or admit patients from Kisumu, especially those who required intensive care, ICU. So far, we have admitted 2. As we speak right now, one is still in ICU, the other one has recovered. So very soon, she will be released from the facility. But I want to say that our ICU is very ready, and in the event that happens, we'll take care of our patients.
I'm Marvin Nandwa, working as a biomedical engineer at Kakamega County General and Referral Hospital. And currently where we are, this is the oxygen generating plant, and we are able to produce oxygen that is serving the facility at a current supply production rate of 300 liters per minute. This oxygen is piped throughout the hospital and is able to serve our patients, including COVID cases within the hospital and also critical care areas.
If you compare now and when you didn't have the oxygen plant, how is it?
Yeah, in comparison between now and when we didn't have the production plant, we can say a lot has improved in such a way that we are able to capture the needs of oxygen to patients at this moment. And like before, when we had to purchase and procure oxygen to serve the patients in the facility.
In terms of consumption per minute, how much is it consumed?
The current consumption rate, especially for COVID patients, is quite high. You realize the COVID patients at times with SpO2 levels that are too low, they consume up to 15 liters per minute, at a flow rate of 15 liters per minute on every patient, which is quite high.
We're hearing some sound. Maybe what is it? What is the sound?
The sounds you are hearing from the background is most of the production, and this plant actually sucks air just from the environment. This air is processed by removal of all other gases, and whatever you are hearing is much of the removal of gases from the system so that we can be able to remain with the oxygen at a purity of above 95%.